Welcome to SDAHO's Soundbites, short audio clips that focus on specific topics from our webinar sessions. Today's soundbite comes from our February Medication-Assisted Treatment webinar.
I didn't get this in my pharmacology curriculum, and certainly not in med school. Probably a little bit of exposure to it, but not in the way that I would have felt comfortable. And it was just through having a faculty member who was a huge proponent of MAT and learning from him, and then eventually kind of having to take on his panel of patients when he left down here at Falls Community Health. That was the impetus for me. And so some of it is just trusting that you can do it. And once you get started in it, I think most people will find that it's actually not as scary or even as complicated as it I think is stigmatized to be. Certainly substance use disorders, it's a complicated condition, but I mean, medicine is complicated, the human body is complicated. And so just recognizing that we're all capable of doing it. And I truly think you won't find much else, for me anyway, that's been as satisfying as helping patients through this, and seeing the success that they can have with Suboxone and Subutex. I have a couple patients that are doing so well on injectable naltrexone or Vivitrol, and it's just fun to see them kind of get their life back on track. And when you're talking about finding satisfaction in your work, I think helping patients through something like this is incredibly satisfying, and makes some of the more complex patients worth it, because they're not all that complex. Some of them just need a little bit of help, and the medicines are incredible. I mean, buprenorphine is, I think, an incredible med. If you're not comfortable screening for it, I think some of it is just jumping in and doing it, and making that just a routine part of a patient intake process, is asking the questions about substance use history. And obviously I like talking about opioid use disorder, but we, especially in our state, have a big issue with alcohol use disorders. And so I think that screening is really important. And we just kind of have a grouping of, it's alcohol, it's illicit drugs, it's inappropriate use of pain medications. Like that type of question is just asked at pretty much every visit that patients come to our clinic for. So once you ask those questions, you're going to get the answers. You do want to be prepared to take care of it when you find it. And again, some of that not feeling comfortable or knowing where to refer, I would argue that if you're in primary care, you can do this yourself. It's just kind of reaching, starting the process, trying a patient or two, using resources. Like I said, I want to be helpful to anybody that's kind of unsure of how to start, or I have a case and I'm wondering if this would be an appropriate one. Please just reach out. I'm happy to be that resource. I know that there's some other doctors across the state that are very passionate about this, want to make this less stressful for people. And again, I just did it because I felt like I had to. We didn't have a provider down here that was doing it, and we had patients that needed it. So it was just jumping in, but knowing that there was somebody in my corner that was going to help me and guide me through. And I'd be happy to be that for anybody that's on this call, anybody that's thinking about starting the process. And I promise you, once you get into it, after a couple patients, it's like, oh yeah, I should have been doing this all along. I think we're more comfortable prescribing pain medicine, and probably should be a little bit more leery of doing that than we are of buprenorphine. So just kind of jump in cautiously and know that you've got help if you need it.
To listen to more SDAHO Soundbites, visit us at SDAHO.org.